And good afternoon. It is time for our regular Lunch and Learn. And so today, by request, we're going to be talking about Myasthenia Gravis. Now that's a good thing I've had my phonics lesson, because when you look at this, it is a big kind of intimidating disease. But what it is it is an autoimmune disease. Now, what is an autoimmune disease? And there are several of them. Fibromyalgia, lupus, Sjogren's, rheumatoid arthritis, diabetes is an autoimmune disease. And so an autoimmune disease is when your body, your immune system, what is supposed to keep you healthy, gets confused. How does it get confused? It gets confused because we don't eat properly. We eat foods that aren't foods. How do I know that? Because anything that's in a box or a package is a modified food, maybe not really a food, and we eat that and we think that it's food. Our body feels full, and so we feel like it's food, but we have no nourishment. And so what do we have? Instead of that, we have toxicity. We've got chemicals. We've got like lead and mercury and aluminum and all those kind of things that we always talk about. And so what that does, it goes into the body. If the channels of elimination are not open, we're not moving our bowels 2 to 3 times a day, we're not urinating appropriately in the day, you should be getting rid of 2 pounds of waste for every channel of the body. So that's 2 pounds of waste from the bowel, 2 pounds of waste from the bladder, 2 pounds of waste breathing, deep breathing, inhaling and exhaling, and then sweating as well is another channel of elimination. And so if we're not doing that, and most people are not doing that, then the body retains the toxic load. The toxic load gets stuck in the liver gets congested because your liver is your main filter. And when that happens, we get heavier. So when you're, having a weight challenge and you can't move the weight, then that is because you've got toxicity there. And so when you have all of that toxicity, the body does not know what to do with it. And so the immune system gets confused and it says, I don't know what to do. Things are not moving. I'm working hard. I don't know what to do. So I'm going to turn and do something else. And so that's how we get autoimmune diseases, is when we have chronic inflammation and the body becomes confused and your immune system starts to attack your own body. That's what Hashimoto's is. Okay. That's what Graves' disease is. So there's just a lot of things that go in with autoimmune disease. Now, remember, I am not medical. I am researching. I am holistic. We look at things differently. In my office, if you've been watching any of my videos, you know that we talk about frequencies. The body works best. The body works optimally when the frequencies are in sync. Think of an orchestra, think of a symphony. Whenever the musicians, the instruments are all tuned to the same frequency or to the same note, we'll say middle C for lack of a better word, then everybody is harmonious. And when we play, even though everything makes its own sound, it's all congruent and it's very, very pretty. When our immune system gets jacked up, that's a medical term. When it gets jacked up, then nothing is pretty. Nothing is in harmony. There's discord, there's dissonance, there's all those kind of things with the frequencies. And so that dissonance with the frequencies causes the body to go into autoimmune dysfunction, or into immune dysfunction, I guess is what I should say. So Myasthenia Gravis is an autoimmune disease. They don't know why we get it, okay? I think it's between 12 and 24 people per 100,000. So it's not something that most of the population is going to deal with, thank God. They don't know what causes it. We do know chronic inflammation leads to autoimmune disease. So if we get the inflammation in check, then we have a better a better outcome of either not going into an autoimmune, or if we can get the inflammation in check, then we can actually reverse autoimmune disease. Now, the medical profession will say you cannot reverse autoimmune disease. They're going to tell you that. And from their perspective, they're right. From our perspective, the body is the only thing that heals itself. Drugs are not going to heal you. Herbs are not going to heal you. Nothing's going to heal you except your own immune system. And so when we give you a tune-up, for lack of a better word, and we get you functioning at that level that you need to, the body knows what to do. The body knows how to clear itself out, and the body knows how to get well. So what is myasthenia gravis? It is a chronic autoimmune neuromuscular disease that causes weakness in the skeletal muscles that worsen after periods of activity and improves after periods of rest. These muscles are responsible for functions involving breathing and moving parts of the body, including your arms and your legs. The name Myasthenia gravis, which is Latin and Greek in origin, means grave or serious muscle weakness. There is no known cure, but with current therapies, most cases of myasthenia are not as grave as the name implies, all right? Available treatments to control symptoms often allow people to have a relatively high quality of life, and most individuals with this disease live a normal life expectancy. So that's a good thing. However, everything is an effort with people that have this disease. The hallmark of this disease is muscle weakness that worsens after periods of activity and improves after periods of rest. Certain muscles that are affected the most are your facial muscles. So your eyelid, your eye movement, your facial expressions, chewing, talking, and swallowing are most often, but not always, involved in the disorder. And so, that would be something that would be really difficult for me, because guess what? I talk all the time. So I'm just saying, those are the muscles that are most affected, although other muscles can be affected as well. The onset of the disorder may be sudden. The symptoms often are not immediately recognized as this disease. The degree of muscle weakness involved it varies greatly among individuals. So these are some of the things that we look for. Weakness of the eye muscles, okay? Drooping of one or both of your eyelids, blurred or double vision, a change in facial expression, difficulty swallowing, shortness of breath, impaired speech, weakness in the arms, the hands, the fingers, the legs, and the neck. So it does involve the whole body. Sometimes the severe weakness of myasthenia gravis may cause respiratory failure, which requires immediate emergency medical care. Now, if you have this disease, you're always going to be focusing on how your breathing is, because one of the most fatal issues is you're not able to breathe, and they call that a myasthenic crisis. All right, this is when your breathing cannot support your life, okay, and you require a ventilator to help you breathe. This can be triggered by an infection, stress, surgery, or an adverse reaction to a medication. So a lot of things can go into this. So if you do have myasthenia gravis, then you always want to be paying specific attention to how you are breathing. If you have any kind of breathing difficulty, it's going to be much more serious for you than it is for somebody without the disease. So approximately 15 to 20% of the people with myasthenia gravis experience this at least once in their lifetime. So it's a pretty big deal. Now remember, not many people have this disease, but almost everybody will experience a respiratory crisis at least once in their lifetime. So we got to kind of, figure that out. So what causes it? Well, we don't really know what causes it, except holistically, we know that what causes it is overabundance of toxicity in the body. Remember, we get toxicity from the foods that we eat that are not foods. We get toxicity from synthetic fabrics that we wear. We get toxicity from cosmetics, body lotions, all that kind of stuff. If you are a mechanic, you're getting toxicity because you're touching all the oils and the fluids and you're working in the grease and all that kind of stuff. If you take a lot of pharmaceuticals, you're getting toxicity that way. Why? Because most of the pharmaceuticals here in the United States are made out of petroleum products, and those certainly are not something that need to be ingested. I was talking to a lady in my office today, and she was telling me that she puts this specific cream on her children, and it is a holistic alternative to, say, like Vicks Vapor Rub, which everybody loves Vicks. I'm not saying anything against Vicks. However, this is a holistic alternative. Well, when we looked at the ingredients, we found that it was not all that holistic because at its base was petroleum jelly. Well, we don't want to be putting petroleum jelly on our bodies because our bodies absorb whatever we put on it. So we need to be very mindful. If we have injectables, and of course, we've got schedules for those. The injectables have a lot of adjuvants in them, and the adjuvants are very toxic to the body. And so that's how we get a toxic load. The body is really, really smart. As I said, if we're moving our bowels 2 to 3 times a day, every day, the body has a really good chance of getting rid of all that stuff. But when we're looking at people who come in and they sit across the table from me, we know that most people do not move their bowels 2 to 3 times a day every day. Some people move their bowels 2 to 3 times a week. We have had people that don't move their bowels once in 7 weeks. So, do the math. The less you get things out of the system, the more buildup you're going to have. When the body has stuff in it that the body doesn't like, it creates an immune response. That's how we stay healthy. The immune response, the inflammation tells the body we've got an invader here, whether it's a fungus, whether it's a germ, whether it's a virus, whether it's a parasite, whatever it is, we've got that in the body. And so we need to take care of it. So inflammation is an immune response that tells the body's soldiers where to go. If the body's soldiers can't resolve the issue, it turns into chronic inflammation. Chronic inflammation breeds sickness and disease, and ultimately autoimmune disease. So I hope that's really understandable for you. All right. Myasthenia gravis is caused by an error in the transmission of nerve impulses to the muscles. This occurs when normal communication between the nerve and the muscles is interrupted at the neuromuscular junction, the place where the nerve cells connect with the muscles that they control. And these are all over your body. So in your mind's eye, if you're over 4th grade level, okay, because everybody has 4th grade health, you learn anatomy, at least the basics of anatomy. You've seen a poster, you've seen a picture, you've colored in your coloring book the muscles in the body. And so anything that makes your body move is a muscle. So this disease breaks down the communication between the nerve and the muscle, which is why the muscles don't respond the way they're supposed to, okay? So there's all kinds of information about that, which if I talk to you about that, it's going to sound like Charlie Brown's teacher, so I'm not going to talk to you about that, all right? So the thymus gland, which your thymus gland is right about here, all right? You've got your thyroid here, right in your neck, so your thymus is just a little bit lower than that. If you do the Carol Burnett, you can hear your voice vibrate. That's where your thymus is, right there, okay? It is your main immune gland there, and it is one of those glands that we don't really pay attention to because we pay attention to more of the hormones and that kind of thing. So we want to know that the thymus gland is the gland that controls all of this. So it says in the report that the thymus gland controls the immune function and may be associated with myasthenia gravis. It grows gradually until puberty, and then it gets smaller and is replaced by fat. Throughout childhood, the thymus plays an important role in the development of the immune system because it is responsible for producing the T lymphocytes or T cells and a specific type of white blood cells that protects the body from viruses and infections. In many adults with myasthenia gravis, the thymus gland remains large. People with the disease typically have clusters of immune cells in the thymus gland and may develop tumors there. So one of the therapies that they do is they remove the thymus gland, which I don't think is a really good idea. You know, I personally don't think that you want to remove things that God put in the body just because I think God's really smarter than we are. And if it's in there, it has a purpose in there. And so we do that. I know in adults, your spleen is a lot more active in your immune system because it activates the blood cells and all that kind of stuff. And so we want to take care of that. We want to take care of our body, but that is what, if you have myasthenia gravis, your medical people are going to want to take your thymus out, and there is some evidence that does help with the disease, okay? Myasthenia gravis affects both men and women and occurs in all racial and ethnic groups. The most commonly impacted people are young adult women under 40. So I guess I'm safe, okay, because I'm well over 40. Older men over 60, but it can happen to anybody at any age, okay? It is not inherited. It is not contagious. So we need to know that, all right? Rarely, children of a healthy mother may develop congenital myasthenia. It is not an autoimmune disorder, but it is caused by defective genes that produce abnormal proteins in the neuromuscular junction and can cause similar symptoms as, myasthenia gravis. So the doctor has to give you a test to see if this works for you. All right, so this is what it is. The weakness is a common symptom of many other disorders. So getting the proper diagnosis takes time, and the diagnosis of myasthenia gravis is often missed or delayed for up to 2 years, all right, because it's just difficult to diagnose. So, as I said, they do the thymectomy is how they call that. They give you monoclonal antibodies, which we all know what that is because we have been alive after 2020. They give you and I'm gonna botch this, anticholinesterase medications. All right, so what this does is it treats the dysfunction of the nerve cell and the muscle cell. They give you immunosuppressive drugs, which we don't like. And they do intravenous immunoglobulins, which I'm not really a fan of that either because they're getting it from somewhere and it is not in your own body. So what do we do? Because we're different. We're not medical. We do differently. So what do we do? Well, the first thing that we do is we have to get your body unconfused. All right. And so how do we do that? Well, I have 2 different products that we use. We have done this very, very successfully. I think I've only ever had one person come in with myasthenia gravis, but we do have people that come in all the time with Lyme disease, with Hashimoto's, with diabetes, with Sjogren's, with lupus, all those kind of things, rheumatoid arthritis. We see that all the time. And so we're not lacking for people that have immune issues. Now, do we heal autoimmune issues? No, we do not. What do? We get the body back to health so that we can move forward. So one of the things that we use, and I love this, it's probably reversed on your screen, but it says restoring cellular communication pathways. And you see up here is a tree and then the roots down here are exactly the same, right? So with homeopathic medicine, they have a saying, as above, so below. So if you get this right, this will come right. So this is kind of like your frequency body, and this is like your real body, your physical body that you live in. So we do this protocol. Why do we do this protocol? Because this protocol will actually take whatever is offending your immune system, it will take all of your systems, your neurological system, your physical system, your immune system, your digestive system, your eliminative system, all of those systems, it coordinates them and gets them in sync, get their frequencies in sync so that you're able to function the way you are supposed to function. And we have seen, because we do bioenergetic testing, we have seen people come in, and I call it when they come in, and you don't have to have an immune issue for this to happen, but when people come in, they're on low battery mode. What does that mean? That means when I'm testing their frequencies are like this instead of like this. So when their frequencies are low, that means they don't have enough energy at the cellular level to be able to function and to be able to heal themselves. And so just like on your phone, just like on your tablet, just like on your watch, if you don't plug that sucker in every night, guess what's happening? You're going to be on low battery mode. When you're on low battery mode, none of your apps will work because your device is going to tell you we're going on low battery mode. So your body does the same thing. Your body goes on low battery mode. So this particular protocol adjusts all the things that are going on in your body, traditional Chinese medicine, very synchronistic. All right, that means it all works together, that doesn't fight each other. And in 90 days, your frequencies are way better. Now, are they perfect? Probably not perfect, but they are way better. We do know of one person who in 90 days was no longer diabetic by medical records, not by what Dr. Pauly says, by medical records. We've had people that have been on this protocol with Lyme. We've had people with Hashimoto's, and we've seen their numbers get better. We've seen their blood work get better. So we know beyond a shadow of a doubt that that works. Now, there are a lot of supplements in there, okay? It's a lot. However, it works. And so you've got to invest in yourself. You've got to look at what your body is doing and what outcome do you want for the rest of your life. Now, we do have another product, and this is a new product, and it's called META, and it stands for metabolic issues. Now, I know Dr. Deb is watching. Hello, Dr. Deb. And I think the phone tells me you want to join the call. Do you have something to contribute on this call? Let me know. META is for any metabolic disorder. Well, what does that mean? That means every sickness, every disease, every dysfunction is a metabolic dysfunction. And so if this product goes into the body and corrects metabolic dysfunctions, what do you think is going to happen to your immune system? It's going to sort your immune system out. This is 4 pills a day, that you take once a day, whereas this one, right, is a lot more. However, they both work. They work in different ways. So, whatever you want to do, we've got an answer for you, right? So this is what we do. We get the body in sync with itself. I was in the band as a young person when I was in school. And they would go to this section of the band and tune. They would tune. Everybody would tune up. And the band director would go, hey, you over there, you're not in tune. Clean your reed or moisten your reed or make your mouth, tighter or rosin up the bow or whatever, right? The conductor would tell you, the band director would tell you, you're out of sync, straighten up, right? This works with your body, and it goes into the body and says, you're out of sync, straighten up. That's what we want. We want our body to straighten up. Now, I am not somebody that believes that as you get older, you have to have sickness and disease. That's just not part of my worldview. My worldview is God is really smart, and he put everything within my body to keep me strong a long time. Okay, so I believe we're supposed to live out our days with all of the faculties that we came into this world with. Now, if you've heard me talk before, you know that Moses is one of my heroes. He was 120 up and down that mountain, not sick, not lame, not deaf, not blind, not mentally deficient. right? Those are all the things that happen to us as we get older. We have ambulatory problems. We have hearing problems. We can have mental problems. We can have vision problems. We have all the things, right? So people have the understanding that as you get older, I'm going to get X, Y, Z. No. That's not how we think about things. We think that if we keep the immune system doing what the immune system is supposed to do, keep the body doing what the body is supposed to do, keep our metabolic processes doing what they need to do, then we don't ever have to succumb to any sickness and any disease. That's my philosophy. That's what I do for myself and my husband, and that's what we do for you when you come in. And so if unfortunately, you are struggling with an autoimmune disease, we've got answers for you, okay? We want to help you. We want to let you know that you do not have to go into your older years fearing sickness and disease. I used to, when I was younger, I used to think I want to protect my brain because I don't want to be one of these older persons that has mental issues, right? I still don't want to be somebody that has mental issues. But right now, what do? I do a lot of things metabolically so that I don't have mental issues. I do this every year, okay? This is a brand new product, but I'm doing this too. Why do I do this? Because it corrects every metabolic dysfunction. It's a 90-day protocol. This also is a 90-day protocol. So whatever it takes, right? I don't want to age. I don't want to get mentally deficient. I don't want to have all the things that older people get. So I am investing in myself, being proactive, keeping my body with the nutrition that it needs so that my body can function the way it needs to. So even though we've talked about this autoimmune disease today, and it is a grave disease, hopefully you don't have it. Somebody has it because they asked me to talk about it. They have it. They have family members that have it. They need to know about it. Whatever the case is, I'm happy to give you information on that. But I don't want you to take that information. What I want you to do is say, well, we may have this, but we also have this and this that can help us get out of that. So I'm going to leave you on a good note. I love you guys. Thank you for honoring me with your presence. Thank you for commenting. Thank you for sharing. If there's anything specific that you would want me to talk about, we do this every Friday, almost every Friday. And so I'll help you out. If you have something that you want to learn about, we'll just help you with that. It's the weekend. Take care of yourself. Do a lot of self-care. If you don't take care of yourself, nobody else is going to. And if you don't take care of yourself, you're not going to be around to take care of other people, right? So it's just tons and tons and tons of stuff. So love you guys. Thanks for the referrals. Thanks for all the things, because we couldn't do what we do without you supporting us. So I love you guys, and I will see you next week.